Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today I'm going to discuss about ICD chapter 4 specific coding guideline. So here in this video I'm focusing on diabetes and the overview, types of diabetes, and also for all the types whatever the coding guidelines we have we will discuss that, and additionally we will discuss about insulin pump malfunction and other few important coding guidelines. Okay, so let's get into PPT, and if you have not yet subscribed to my channel, please do subscribe. And if you find it informative and if you find this video is useful, please do share with your medical coding friends. Thank you.
Today I'm going to discuss about endocrine, nutritional and metabolic disease chapter specific coding guidelines. So ICD code range between E00 to E89. So mainly in this video I'm focusing on diabetes and diabetes coding guideline. So we will check what are the important coding guidelines we have in the chapter 4. So what is diabetes mellitus? DM is a chronic health condition that affects the body's ability to produce or properly use insulin. So we do have types, and each type has a specific coding guideline. We will check every coding guideline in brief. Types of diabetes. Type 1 diabetes mellitus ICD code range is E10 series. So type 1 diabetes is also called as juvenile diabetes. This because it occurs in childhood or adolescence. So type 1 diabetes is common in the children, and what happens here? The body immune system attacks insulin producing cells in the pancreas, leading to a lack of insulin. Okay, so ICD code just an example. Type 1 diabetes mellitus without complication, we can code E10.9. Okay. Next, type 2 diabetes mellitus. Type 2 diabetes is too common a type and usually develops in adult, and it occurs when body become resistant to insulin. Okay, example E11.9 type 2 diabetes mellitus without complication. So for type 2 diabetes we have code range E11 series. Okay, here I am just added the types. Later we will see the specific coding guideline. Next we have secondary diabetes mellitus, which code ranges is E08 series, E09 category and also E13 category. E08 belongs to diabetes due to underlying condition. E09 belongs to drug or chemical induced diabetes, and E13 is other specified diabetes mellitus, often due to other factors such as endocrine disorder or genetic conditions. Okay, based on the proper documentation, we have to find out what is the cause of the diabetes and we can code it accordingly. Okay, so secondary diabetes is always linked to an external cause of condition such as another medical disorder, drug or a pancreatic injury. Okay, just an information. Next type is gestational diabetes. Gestational diabetes which develops during the pregnancy. Okay, that woman who did not have diabetes previously, but during the pregnancy, maybe in her second trimester or third trimester, she developed diabetes. Okay, then it will goes to gestational diabetes. We do have codes for pre-existing diabetes if she is pregnant, but before getting pregnant she had the diabetes, then we will code for pre-existing diabetes during pregnancy. So example code O24 O series. So our first coding guideline regarding type 1 diabetes mellitus. Type 1 diabetes is also called as juvenile diabetes, so which comes early in life, that is early childhood or adolescence. Okay, but do not think age is a determining factor. In the question, if you see a 13-year-old patient got type 2 diabetes, then seeing the patient age 13 year, you should not conclude it is a type 1 diabetes. Okay, so it's just an information that in most of the majority cases, type 1 diabetes will be coming in the childhood or in the early adolescence age. Okay. So here you can see that as we discussed, the code range is E10 series. So next coding guideline is regarding pre-symptomatic type 1 diabetes mellitus. The code category from E10.A series. Here we do have stages, and if the stage is not specified, we will go with the unspecified pre-symptomatic diabetes. So you can see the question, what code is used for patient diagnosed with a pre-symptomatic type 1 diabetes unspecified stage. So we can go with E10.A0. Next coding guideline is regarding diabetes type is not documented. Okay, so we have one default guideline here. So in the scenario, if the provider is not specifying whether the patient is having type 1 diabetes or type 2 diabetes, default we should select type 2 diabetes mellitus. Okay, E11 category we have to go, and you can see the question, if the type of diabetes mellitus is not documented, which type should be assigned? So the answer should be type 2 diabetes mellitus. Okay, check the scenario, check your question. If they are specifying type 1 diabetes mellitus, you can go with the type 1. If they say type 2, you can go with the type 2. But if they are not saying any type, then default you can select E11 series code, that is type 2 diabetes mellitus. Next guideline is regarding diabetes and medication use. So when you got diagnosed with diabetes, and if you are coding ICD code for diabetes, in the instructional note you can also check, or you can also see that use additional code. Okay, you can see additional code insulin, oral hypoglycemics, and injectable non-insulin. So in the scenario or in the documentation, whatever the medication is specified, you have to use that additionally with the diabetes code. If they are saying patient is using insulin, you will be adding Z79.4. If they document patient is taking oral hypoglycemic, then you should select Z79.84. And if they say injectable non-insulin, you have to go with Z79.85. Okay, sometime patient will be taking 2 or 3 drugs. The patient can also take insulin also, and again oral hypoglycemic also. So if you see 2 drug, then we have to code both the drugs. Okay, there is no specification. If every drug is documented, you can capture all the drug usage with the additional code, and if they specify any one drug, you can use any one drug as a additional. Okay, so you can see the question here. Patient has been diagnosed with a type 2 diabetes mellitus and using oral hypoglycemic drug and injectable non-insulin. So here in this question, patient is taking 2 type of drug. One is hypoglycemic and one is injectable non-insulin. Okay, so we have to code, we have to capture along with the diabetes code, we have to capture both the medication. Okay, don't leave any of the medication, code all the medication. So here hypoglycemic drug code will be Z79.84 and injectable non-insulin will be Z79.85. Okay, so the answer should be Z7984 and Z7985. Answer C will be correct. So here the guideline is you should check how many drug the patient is taking, and all the drug usage you can capture with the diabetes code. Next coding guideline is diabetes in pregnancy. So as we discussed, firstly we have to check whether the patient had diabetes before the pregnancy or she developed diabetes during the pregnancy. Okay, during the pregnancy if she got diabetes, then it will go to gestational diabetes, and if before pregnant she had diabetes, then it will go to pre-existing diabetes. Okay, we do have a separate codes. Now next guideline is we'll talk about the gestational diabetes. Gestational diabetes code range is O24 O24.4 series code. Okay, O24.4 series, and O24 3 2 1, all these three series will go to pre-existing diabetes. Okay, when it comes to gestational diabetes, make sure you should not use any additional medication code. Okay, we have the codes in the main ICD code itself. We will get the information about which kind of drug patient is using. We have the code gestational diabetes, during pregnancy, controlled, diet controlled, and hypoglycemic controlled or insulin controlled. Likewise, in the ICD code description itself, we have the information. So you don't need to assign any additional code to show the medication indication. Okay, just go with, see this question, pregnant patient diagnosed with gestational diabetes controlled by oral hypoglycemic drug. So if you check O24.415, this will give the information about the drug also. Okay, so no need to use any additional drug code. Next important coding guideline is complication from insulin pump malfunction. So this pump malfunction can lead to underdose or overdose. Whenever we are sequencing ICDs regarding pump malfunction, mechanical complication should be coded first. Okay, T85.6 series should be coded first, and secondary code we will be coding based on the documentation. If it is underdose, you can select T38 3x6 series code, and if it is overdose, that is poisoning, you can select 38 3x1. Okay, T38 3x1 series code you can sequence secondary. And in the third place, whatever the diabetes is diagnosed, we have to code it in the third place. So here a patient with a type 1 diabetes mellitus is admitted to diabetic ketoacidosis caused by an insulin pump malfunction. Okay, so here the primary code should be mechanical complication from the pump malfunction. It should be T85.6 category code should be sequenced first. Okay, so these are the brief guidelines. I have not explained everything in detail, but I have just give you an idea and overview. And for further, if you need all the guideline with the extensive practice question, please do join my class. Okay, so that's all for today. And still we have many coding guidelines from the chapter 4. And again, when I get time, I'll try to cover that also. Thank you all. Thank you for watching.